at least part of the day, but I wasn't expecting until late last night to be here presenting something which is very much my colleague Suzy Braye's presentation about some work that she's been directly involved in, and I hope I know well enough to be able to offer you Suzy's presentation. That's why my name's there in small and hers is there in large. I think it's a slight shift of gear. What Suzy's wanting to talk about today is a particular initiative that she's been involved in that is actually about two things, or can be taken at two levels, I think, in terms of its relevance for discussions here today. The first is it's about an initiative which was focused on trying to see how we can improve the evidence base for outcomes of professional social work education, and this is qualifying social work education, but it was about improving the evidence base, which involved thinking quite hard about what counts as evidence, thinking quite hard as what count as learning outcomes for social work education, and quite hard about how we might capture or measure those in a way that enabled to tell us about what works. So there's that level of looking at learning outcomes and how we establish a better than we had evidence base for what works. But a second level, I think, is about the processes through which a group of social work educators enabled themselves, or were enabled to do the work that they did in trying to improve the evidence base about what works, and then to apply what they learn. So that's my understanding really of, I think, how Suzy is framing this. To give you a little bit of context for Suzy's project, the whole initiative was set in a recognisable to all of us set of priorities around improving what works in our various different professional domains. So a UK-wide focus on establishing or trying to identify better than we have done what works in in social work. SCI, Social Care Institute for Excellence, is the body that was really funded by the Department of Health to help develop the evidence base for social work and social care, and in this case for social work education. There were continuing debates around about what actually constituted evidence in this field, set alongside a series of imperatives or drivers for us to focus in particular on improving social work education. And here we had a set of drivers that were actually coming from numbers of inquiries of social work failures, yet again more social work failures, child deaths, etc., indicating same old lessons need to be learned, we need to educate and train our social workers to do a better job. And over here, in I think 2003, the government actually investing in a whole new qualifying social work degree to try to improve standards of social work education. How did that take shape nationally, or how did the initiative to try to improve the evidence base? SCI, Social Care Institute for Excellence, with Department of Health funding, commissioned a whole set of reviews of the knowledge base, the existing knowledge base, about quality, nature and quality and outcomes of social work education. Those reviews were based partly on systematic reviews of the existing literature and partly on what they call practice surveys, so investigations, empirical investigations into actually what's happening out there on the ground. And those inquiries, those different commissioned inquiries, focused on, I won't go through them, but five key areas of social work qualifying curriculum that are the areas designated by the Department of Health, that the key priority designated curriculum areas. So a whole set of different reviews into what we know already generated a whole programme of reviews and practice inquiries, resulting in a whole set of publications in which we at Sussex were involved centrally in quite a few as what was called a registered provider of knowledge reviews for SCI. What we also did, we and others, were out of our reviews of the existing evidence about, for example, what helps to promote social work students to learn about law, what helps to promote to work about working in partnership with service users or with other professionals. We also developed a set of different accessible resource guides and e-learning resources to try to enable or help other educators to make use of this knowledge in their own practice. So far, so good, says Suzy. There were strengths to this, but also some limitations. The knowledge reviews were based on a fairly restricted or to some extent flawed evidence base. Most of the research that they were based on was qualitative. Many of the accounts, often when we were doing these reviews, it was very hard to tell whether what you were reading could count as a research paper at all, or whether this was just a discussion piece of somebody saying, we did this and it all worked very well and our students were very happy. Lots of descriptive accounts and lots of outcomes just based on sort of perceptions rather than anything that felt like harder evidence. So from that came a push towards a more robust evidence base for what works in professional education, quantifiable outcomes if possible, and a genuine focus on how any of social workers' learning actually impacts on what they do in practice. And that led to Sky commissioning what became known as the Suzy project, which was looking at the outcomes of social work education. And here John Carpenter, who basically, chaired that or facilitated that program, was basically saying that, the poor quality of the designs of much of the evidence, the research that's generated the evidence we have about what works in social work education gives us limited information really that we can make use of, and it's not a good enough evidence base. So the Suzy project was designed to try to achieve something better, both to generate better evidence and to really enable social work educators to think harder, conceptualize and map harder what we mean by learning outcomes, how we tailor what we teach to the outcomes that we want to achieve, and how we try to sort of capture and measure all this. That involved, of course, primarily an initiative which was about developing social work educators' capacity to research in a way that was more robust, to produce the evidence base that could then be brought into and applied in social work education. So John Carpenter, in a volume published by Sky, for which we've got the web reference there, basically wrote a very impressive discussion piece that was focused on education outcomes, how we understand them, how we can measure them, different kinds of approaches, concept mapping the field and looking at the issues of measurement, and outlining a range of possible ways of trying to approach and measure learning outcomes. What it also led to was establishment of a learning set of, I think originally 6, and then I think it rose to 9 or so, different HEIs, different university social work departments and educators within them who were, whose aim it was to try to develop their own methodological expertise in trying to establish the evidence for what worked in some or other area of education provision within those 5 areas of core curriculum areas. And to do that, so they were partly trying to, develop their own capacity and also to enhance the evidence base for professional learning in social work. That group of, I think 9 or so in the end, social work departments, they formed a national learning set who met, again, Suzy would tell you the detail if she were here, but I think they met 2 or 3 or even 4 times a year as a group nationally, with a lot of virtual kind of meeting as well, to collaboratively try to sort of learn with and from each other about their efforts to evaluate particular strands of education practice, social work education practice development. They were all looking within their own universities at quite different sort of teaching and learning initiatives. Some, I think, were trying to evaluate students' learning outcomes from the whole of a social work, qualifying social work programme. Some were looking at just the impact on students' learning of one module. Some might have been looking at 2 days' worth. So they were doing, it was completely liberty to look at whatever they were interested to look at, but to try to work together on the issue of how you look at it and how to try to establish a relationship between what you do and what you provide as educators and actually what students learn. Because each HEI it required a lot of buy-in from each university and from each team of colleagues, and I think in each centre colleagues formed their own learning sets, or at least their own little sort of learning communities, to try to develop their work in whichever particular part of their activities they were trying to evolve and evaluate. This comes from John Carpenter's original volume. What he was doing here was trying to draw on a model, actually, which would be familiar to some people, a model for categorising learning outcomes that came from Kirkpatrick in the 60s, and then I think it was developed since by Krieger in the 90s, and John Carpenter has done some more with it. And I won't go through it in detail, but what we're trying to do here was to enable educators to think about these different dimensions on the right-hand side of learning outcome that they were interested to try to affect through the teaching of the learning experience that they were providing. Cognitive skills, affective behaviour, and actually impact in terms of whether it makes any difference to end users. And alongside that, try to look at what kinds of ways we could, as educators, we could develop and use to measure learning outcomes across those different dimensions. I won't go into the detail there, but you can see what the aim is to try to match in a way that really hadn't very well been done before, from all as our systematic reviews suggested, to actually even develop the right ways of trying to tap into the learning outcomes that the particular education interventions are trying to achieve. The project itself, that whole programme, I think it lasted for 2.5 years, and the results of those learning sets, what they achieved and actually what they established by way of informing the evidence base, as well as what they learned from the process, was published in another volume edited by Hilary Burgess, also at Bristol University with John Carpenter. What the project showed, though, that was key, was that it was more possible than had previously been either attempted or done to measure learning, and that the approach to learning could be used in a way that helped to sort of improve both teaching and maximise learning. And that quote came very powerfully, that endorsement of this programme came from Dame Maura Gibb, who is was the chair of the social work task force that was set up in the wake, in particular, of the Baby P inquiry, to try to take forward and reshape social work profession and social work training, and she moved on from chairing the task force to what it became, which is the current Social Work Reform Board. Mixed results actually that came out of that programme. My understanding of what was reported in the end about the experience of the educators, as well as what they found worked for students, was we became quite a lot better at measuring outcomes. So there was a kind of refinement and a development through this collaborative endeavour in actually finding ways collectively of, for example, using videos and video recordings and appraising or assessing students' learning in response to vignettes or in response to videos that they saw. Big advancements in how we actually used concept mapping to judge students' learning outcomes in terms of their cognitive abilities to actually understand and frame problems, and also in developing scales that captured student social workers' own sense of their own efficacy and as well as confidence, actually. huge challenges though, and this is where for the educators learning, it was really very difficult for various reasons for the educators themselves to develop their research practice in conducting the research in their own professional environments that would lead to this robust evidence base. So most of the studies that these different learning sets did were themselves single case before and after designs with no comparisons group, students going through a course, a module, whatever it may be, measure them before, measure them after, see what the difference is. It's actually incredibly difficult, I think, just to, for all sorts of ethical and practical reasons, including timetabling reasons, for example, to get match groups working in a different time series, for example. Some group gets a module at one point and then another group gets the module slightly later, and you look at their different trajectories of learning over time. Attributional unreliability, I think what she's getting at there is that because of these designs it was actually very difficult to know whether we could attribute changes in students' learning outcome to what they got in the education programme or the particular intervention that was involved, or to any other number of other things, including maturational effect, which is simply students as they develop and participate over time in the course generally move forward, and the Hawthorne effect that they know they're being looked at, so they learn how to answer evaluation questionnaires rather well. So ongoing need for more robust designs. Here though, what Suzy is talking about, I think, is her own work. What she was interested to see was whether after this initiative had completed, whether it was possible to continue effectively this kind of model, to replicate this collaborative capacity building model between social work educators, and use the learning set approach beyond the lifetime of that particular project. And what she led was another group, I think, a learning set of another group of, again, I think around half a dozen social work HEIs and key lead social work educators in them, who were involved in a project which was to try to use some of the e-learning objects. Suzy had been responsible for one of Sky's original knowledge reviews on how students learn best about the law. From that came these e-learning tools and objects which were generated for educators to try to use. This was about getting a learning set of educators together to try to use and evaluate the use of those e-learning tools in their social work education programme, and then to try to evidence what the impact of it was. I had a conversation with Suzy very late last night about the bits of her slides that I wasn't sure I understood, and the bottom box there, we actually changed the wording of, I added in the word challenge. What Suzy wanted to say was that there was strong evidence that came out of this initiative of the value of educators themselves learning and working and developing their own practice in collaboration with each other to achieve better student outcomes in their use practice. The challenges, though, were really quite significant as well. So I said to her, can I add in the word challenge? And she said, yes, all right then. And the challenges were, it was actually very difficult for the different social work educators in their different contexts to get them all sufficiently evaluating the same way of using the e-learning, or same ways of using e-learning objects, and in particular using the same evaluation tools, questionnaires to students, questionnaires to social work educators. They kept tweaking them, they kept changing them to fit their own context. It became, I think Suzy ended up being much more prescriptive than she would have liked to have been in a collaborative learning kind of context about, look, if we don't all do it this way, we're not going to be able to compare what worked best for where and for how. So certainly, key issues going forward, we've still got a bit of a way to go on building our evidence base for what works in social work, qualifying social worker learning, but there is emerging better evidence than there was about how different approaches to teaching can have an impact on knowledge, skills and attitudes of students. We do need better research design still enable us to tell that it's the education experience that is making a difference. Research designs that provide evidence of impact on professional behaviour, I don't know if it's the case, I'm sure it probably is in the teaching context as well, but so much of our work that does look at outcomes looks at outcomes up to the end of this module, or possibly up to the end of this qualifying, or possibly up to the end of this CPD course, but what it doesn't do is follow it through over time to see whether there has been both a change in people's actually professional behaviour and a sustainable change. And the last point, yes, that this collaborative approach to building capacity among educators to influence, to build an evidence base and influence learning, it can be effective, certainly can be effective in reaching improvements, both in educators' knowledge and confidence in attaining outcomes. But actually, it's quite challenging, I think, and a way to go. I think that's it. Don't ask me any awkward questions, because I don't.